Welcome back to Later Today. This morning we're talking about the most popular form of plastic surgery in the U.S., liposuction. It's estimated that more than 172,000 liposuction procedures are performed each year. But despite its popularity, there can be serious complications. We talked to one young woman, Libby Homan, who decided the benefits outweighed the risks.
I had been working out 5 days a week, hard, and my thighs were not budging. I had saddlebags that were going nowhere. I was a 10, sometimes an 8, kind of in between there, and now I'm a 6, sometimes an 8, depending on the clothes that I buy. I figured this was the time I would enjoy it most, and if I was going to do it now. I didn't really think of pros or cons, like if something bad, I wasn't thinking something bad could happen.
But it could have. In fact, a recent study suggests 1 out of every 5,000 patients who undergo liposuction dies from the procedure. That's a risk 20 times greater than the average surgery.
My experience was fine. I mean, I didn't have any complications. It wasn't horrible. I think it's really helped my self-confidence and just my overall thoughts about my whole body image, because I think a lot of people struggle with that, and I'm a lot more comfortable in my own body now.
Dr. Jean Loftus is the author of The Smart Woman's Guide to Plastic Surgery, and she's here this morning to explain everything you need to know about liposuction. Good morning, Dr. Loftus.
Good morning.
So this statistic, 1 death in every 5,000 procedures, is much higher than the death rate for most other kinds of surgery, right?
Right, and it's certainly very alarming to plastic surgeons. It's due largely to inexperienced plastic surgeons offering liposuction. One of the most common causes of death with liposuction is penetration of an internal organ with a liposuction rod. And as you can see, this certainly can cause damage. And that tells us that there are people out there performing liposuction who probably shouldn't be.
So this is the thing that's inserted under your skin and sucks out the fat.
Exactly.
But a dentist can do it, right?
I'm not sure about dentists, but it's legal for any physician in the country to perform just about any procedure they want in most states.
And they often do it in their office.
Yes, and that's one of the concerns, is that there's not a lot of control over that.
And a lot of them have this diploma-looking thing on their wall that says board certified, but don't necessarily be fooled by that.
Very much so. It is easy for just about anyone to get a diploma saying they're some sort of plastic surgeon. You can write a check, send it in, and you get a beautiful certificate with little or no training.
So you don't have to be a liposuction specialist. Any doctor can do it,
No.
and that's one of the main reasons it's dangerous. Now, it's also not minor surgery. People tend to sort of laugh it off like, oh, I'll just pop in and get lipo before lunch or something like that, but it's major surgery.
Right, it can be. It depends on the extent of the liposuction, and the reason people think that it's minor is because the incisions are very small. But through those small incisions, we actually sometimes create large wounds, and so it can be very major surgery with some pretty significant complications.
Who is a good candidate for liposuction?
Well, someone who is generally near their ideal body weight and has an area of trouble, like the saddlebags or the love handles, and they just want to bring them in contour with the rest of the body. That's the best candidate.
Well, we have some before and after pictures. You got to have those obligatory before and afters of saddlebags, which refers to the outer thighs, right?
Right.
And that's a better area for lipo than inner thighs.
It is, because
that?
the skin is thicker, and in that woman that we just showed, the problem was that she worked out as much as she could. Her thighs were so big. When she bought clothes to fit her waist, her thighs were too tight, and when she bought clothes to fit her thighs, her waist was too loose.
All right, we also have, I know you've been begging for the rear view. I don't know if it's of the same person, but
no, it's not.
What has changed here? Is this also the saddlebags, or is this the backside itself?
Both the hips and the saddlebags, and the hips we also call the love handle area. In the left picture, you can see she almost looks like she's got a violin or a cello silhouette, and on the right picture, she's a little more in contour.
But this raises the interesting question about cellulite, because lipo doesn't get rid of cellulite, right?
Correct.
Why is that?
Cellulite is very superficial fat, and it causes a dimpling or cottage cheesy appearance of the skin. Liposuction is for the deeper fat. It will reduce the volume, but it's not going to affect what the skin looks like.
All right, and a lot of people have it done here under their chin.
Right.
I was kind of surprised about that. Why is that so popular? I mean, it does make a big difference in a person's appearance, as you can see.
Right. Not only does it make you look trimmer and more fit, but a lot of times it makes you look younger as well. This is a young woman. She's in her late 30s, and she looked a lot older than her stated age because of the fat.
Now, would that be truly minor, just having a little bit sucked out from here?
You know, I think the safest thing is to not consider any surgery minor. And if you see a plastic surgeon who considers something minor, you better look out. But, you know, a procedure like that can be done in a half an hour, and you can go home immediately and back to work in a couple of days.
Is liposuction painful?
It depends. I've had people back to work in a couple of days. I've had other people after a couple of weeks tell me it's still unpleasant. About 5 to 10 days is the recovery period.
And how much does it cost, especially for some of the more major procedures like the saddlebags?
You can bet on paying about $1,000 to $1,500 per area. And by area, I mean one area is the abdomen, one area might be both hips or both thighs. But then you've got an anesthesia fee on top of it, and also a facility or hospital fee. And if you're going to have it done in New York City, plan on paying 1.5 times that. It can add up.
As with everything else. Now, if you go back to your old lifestyle, do you put the weight back on in those areas?
Well, people who tend to gain weight in the same areas as they had liposuction are people who are gaining weight beforehand. So if you're gaining weight, don't have lipo. It's not going to help. You're going to continue to gain weight afterwards. So people who are at a stable body weight for 6 months to a year are going to be the best candidates, and they're most likely to keep it off.
Wow. It's tempting, I guess, but boy, you would think this would be a deterrent right here. Anyway, Dr. Loftus, thank you very much.
Thank you.
And by the way, Dr. Loftus will be here tomorrow to bring us up to date on breast implants. No demos there, right? No demonstrations on the show. Anyway, we'll be right back after this. Stay tuned.